Welcome to the Sutter Roseville Emergency Department expansion, where we've added 34 exam beds and 7 new triage rooms. Let me show you on around. As a patient comes in here, 80% of our volume comes in through the front door. So we have a brand new arrival desk here, where we have the staff 24 hours a day, 7 days a week, with an emergency department triage nurse who is immediately arriving somebody and then also identifying are they sick versus not sick. They will get the chief complaint and they'll try and figure out what's the patient's real condition, what's bringing them into the emergency department. We also have 7 new triage rooms here. These 7 new triage rooms are fully set up to be able to take care of any kind of patient that comes in through the front doors. We have a brand new lobby here. The new lobby is set up with new furniture, very spacious, very full of natural light, and set up in a way that's very homey feeling. Also important to us was the arrival desk here. We have nurses staffed here 24 hours a day. We can directly visualize all of the patients that are waiting for care out here. Hopefully there's none, but if you do have to wait for a few minutes, the nurses always have direct line of sight to every single patient out here. 7 new triage rooms. All of them are set up identical to be able to take care of any kind of patient. Something that's very important to us here at Sutter Roseville is to ensure that the patient is at the center of our care. So as we come on in and take a look at these new triage rooms, you'll see how important it is for us to be able to have the patient at the center. We are working with a model where we have the nurse, the provider, so that would be the medical doctor or the physician assistant that would come in and triage you together in a way that to be able to take care and identify what is ailing you today, whatever that emergency condition is. You may be coming in for something simple as abdominal pain or something more complex like chest pain or shortness of breath. These rooms are fully set up to be able to take care of any kind of minor or major emergency, and these are just the triage rooms. Again, we have 7 of these that are all set up. We have med gases here, we have vital signs monitors, overhead lights, so that way if we want to do suturing for you while you're waiting for just a few minutes, we can turn on these overhead exam lights and suture your wound or anything like that. Come on in. As we transition back from the triage room to the exam room area, we have 34 new exam rooms here. These 34 rooms are set up. We have 20 beds on the other side, 14 beds over here, and they're quickly accessible by the clinical team to be able to support the staff, support the patient, and keep the patient at the center of the care that we're providing.